I'm Dr. Sherwood Baxt, practice in Paramus, New Jersey. I'm a board-certified plastic surgeon. This is a great opportunity. We just finished up in the OR today, and we have all the equipment out here, so it's a great chance to discuss this particular procedure, which is the gynecomastia, or the male breast reduction, and we do a variation of it where there is no scar around the areola. And I believe that's why this has become one of our real signature operations, and I probably do more of this than almost any other procedure these days. All the operations are done here in our own private surgery center, and we do them either under local anesthesia or under local with a little assist from the anesthesiologist, and we call it twilight sleep, or some people use the word conscious sedation. And the operation takes anywhere from half an hour to 45 minutes to do. In any case, it's completely painless. And the question is, how do I do it without making the separate cut around the areola? So everybody does this operation the same way up to a point. We all use this little tool, which is a liposuction cannula. So let's say, for argument's sake, that the patient is sedated. We blow everything up with a local anesthetic, and we do make a little incision, but it's about this big, a teeny little incision somewhere off in a hidden spot off on the side. And then I perform liposuction, so I remove whatever fat there is in there. In some people, the occasional patient, that's the end of the operation. But for the overwhelming majority of the men that we see now, there'll always be some gland in there. Gland is like this, it's rock hard. So most people are going to take a knife now and make a big cut around the areola and go in and take out chunks and sections of that. I'm going to use a very expensive little piece of machinery. I wish we tried to get this on camera with the oscillating head on here, but we can't do it. It doesn't look like very much, but it's a very involved, and the rest of it is off, a big piece of it is off camera over there. This little instrument will now go into that same small hole, and I use it to liquefy and just literally shred up the hard gland, and I suction it out through the same hole. Contours out beautifully. Aftercare consists of ice packs and a tight binder on there. I allow my patients to shower the next day. Most guys are up within 24 to 48 hours, driving a car, walking around, doing normal type things. I'm very liberal with the aftercare because we haven't used any stitches, and I'm not worried about anything tearing open or breaking apart. I'll let you do pretty much whatever you want to do as soon as you feel up to it. So going back to the gym is very early. Going back to work is a day or two or three, etc. There is some bruising with it. There is some swelling with it. There is some discomfort with it. I discuss all of that in person. But this little instrument is what separates out the ability to do it without that little cut, because I can remove the gland with this little oscillating instrument. At any rate, love to be able to discuss this with you in person, and if you want, we're in Paramus, New Jersey. My name is Dr. Sherwood Baxt, and we're looking forward to meeting you.